Dear children, we will move on to the next topic of health infrastructure, that is Indian system of medicine, and one more topic we will discuss, indicators of health and health infrastructure. Now we will discuss with Indian system of medicine. Indian system of medicine is known by the name Ayush. It consists of 6 systems. A stands for Ayurveda, Y stands for Yoga, U stands for Unani, S stands for Siddha, and H stands for Homeopathy. So there are 6 systems of medicine, and first we will discuss with Ayurveda. Now Ayurveda was developed 3000 years ago in India. It believes that health and wellness depends on delicate balance between mind, body and spirit. So it is a branch of study, or it is a treatment system where it believes that our health and wellness depends on the state of balance between mind, body and spirit. Next is yoga. Yoga is a treatment or a system which includes health control, breath control, simple meditation and specific body postures that is widely practiced for health and relaxation. Okay, so nowadays to get more concentration, mental power, people practice yoga. So yoga is a very effective method for the mental health. So a treatment system which includes the breath control, simple meditation and specific body postures that is practiced for health and relaxation. Next comes Unani. Unani is also called Arabian or Islamic medicine, a traditional system of healing and health maintenance observed in South Asia. It is introduced in India by Persians and Arabs. So Unani is introduced in India by Persians and Arabs, and it is also called Arabian or Islamic medicine, and it is a traditional system of healing and health maintenance observed in South Asia. Then comes Siddha. Siddha is one of the India's oldest system of medicine. India's oldest system of medicine. Now it is based on a combination of ancient medicinal practices and spiritual discipline. So it is based on the combination of ancient medicinal practices and spiritual discipline. It is originated in South India, and the father of Siddha medicine is Agastya. It is originated in South India. Now you don't have an explanatory, you don't have to study this Ayush in an explanatory manner. You just need to learn the names of 6 system of Indian medicine, but for your general information you need to know about all these. If you are interested, you can read more about it. Okay, and Siddha is one of the oldest system of medicine. It is based on the combination of ancient medicinal practices and spiritual discipline. It is originated in South India. Then, so Ayush, A for Ayurveda, Y for Yoga, then U for Unani, then S for Siddha, and H for Homeopathy. I have written here one more system here as naturopathy. Let us first discuss with Ayush, that is homeopathy. Homeopathy is used to treat for long-term illness such as allergies, arthritis, then minor injuries, muscle strains or sprains, etc. It is introduced by, or a father of homeopathy is Samuel Hahnemann. So this is with regard to homeopathy. Along with that, naturopathy is also practiced in India. What is naturopathy? It is a kind of treatment which stimulates positive thinking, improves overall health, improves one's ability to cope with health related issues. So this is naturopathy. Just for an information only, you need to know about it. So these are the 6 system of Indian medicine: Ayurveda, Yoga, Unani, Siddha and Homeopathy. Next is indicators of health. What are the indicators of health? That is what we are going to discuss now. Now, just have a look on the situation of the health and health infrastructure in India. Expenditure of health sector is 4.8% of the total GDP. Expenditure on health infrastructure is only 4.8% of the total GDP, which is very low when compared to other developing countries. So India has to improve in that, and 20% of the total population of the people is suffering from GBD. What is this GBD? 20% of the people with GBD. What is GBD? It is known as global burden of disease. What is this global burden of disease? Let us see what is global burden of disease. It is an indicator to measure the number of people dying prematurely due to a particular disease. In their early age, they are dying due to certain disease, as well as along with that, these category of people also belong to GBD. Let us see who is that. Number of years spent by them in a state of disability owing to the disease. This is known as GBD. GBD is an indicator to measure the number of people dying prematurely at the same time, as well as the number of years spent by them in a state of disability owing to the disease. That means they are not able to do any productive things. So they are in a state of disability owing to the disease. They are on bed not able to do anything. That kind, and people who are dying prematurely due to certain diseases. So that is known as a global burden of a disease. It is just an indicator. It is an indicator to measure the health status of our country. So global burden of disease is an effective measure or effective indicator to know about the health status of our country. Now, in India, more than half of GBD is due to communicable diseases. More than half of GBD is due to communicable diseases like diarrhea, tuberculosis, malaria, etc. Then next is every year 5 lakh children die due to waterborne diseases. This is also another indicator. Infant mortality. So I am coming to the point. Indicator, infant mortality rate. If it is high, it means poor health status of our country. So life expectancy is an indicator. Let us write down the indicator one by one. So far we have discussed GBD is an indicator, then life expectancy is an indicator. If a person is dying prematurely, then the health status of our country is poor. If a lot of people are dying like that, that means expected years of life is less for them. So life expectancy is also an indicator of health. Then infant mortality rate. If it is increasing, it is a bad sign of health status. So infant mortality is also an indicator. So there are so many indicators of health. Now, so every year 5 lakh children are dying due to waterborne diseases. Then danger of AIDS is also looming large. So all these are severe, or because of all these, health infrastructure is severely affected. So we can see the health indicators of health once again. GBD as an indicator to measure the number of people dying prematurely due to a particular disease, as well as number of years spent by them in a state of disability owing to disease. Now, in India, more than half of GBD is due to communicable diseases. Then every year 5 lakh children are dying due to waterborne disease. Danger of AIDS is also looming large. So these so many indicators are there. Maternal mortality is also an indicator. Now next is, at present less than 20% of the population only utilizes public health facilities. Only 20%. Why is it so? In the rural areas you can find the public primary health centers are not effectively working. Therefore, government measures should be there to promote the working of primary health centers. People are not getting proper health facilities in the rural areas. So, that is why at present less than 20% of the population only utilizes public health facilities. It is not because they don't want to utilize, they are only less amount of people are getting that facility. Therefore, to the utmost remote areas, government should take measures to increase the number of primary health centers. Then, and only 38% of the primary health centers have required number of doctors. Even if there is primary, why the primary health centers numbers are very less? To utmost remote areas, doctors also have a problem of not willing to go. They are not willing to go to the utmost remote areas. So, that also is a serious issue. Therefore, all those problems have to be solved by the government. And only 30% of primary health centers have sufficient stock of medicines. Stock of medicines are also a severe problem. Only 30% of primary health centers have proper stock of medicines. So, all these deficiencies shows that health infrastructure is not properly maintained in our country. So, taking all these into consideration, government should play an effective role in bringing up the status of health infrastructure in our country. I hope the topic is clear to you. Now, refer page number 8.5 in page number 8.17. The table is 8.5 in page 8.17 for getting information regarding indicators of health. There, maternal mortality, life expectancy, infant mortality, everything is given in the form of a table. You have to refer the table, and what is given there is, you have to refer the table and learn the indicators in India in comparison with other countries. So, when you learn the table, when you analyze that all the indicators given in the table with a comparative study of India and other countries, you will understand where do we stand in health infrastructure. So, properly analyze the table and try to understand where do India stand in the state of health infrastructure. So, refer the table 8.5 in page number 8.17 to know more about the indicators of health. That's all.